Thanks for listening to another episode of Spoonie Radio. I'm your host, Dr. Courtney Craig. My guest today is Jonathan Kerr. Dr. Kerr is joining us today from the Universidad del Rosario in Bogota, Colombia. He has published extensively on gene expression, infections, and inflammation in ME/CFS patients. His prior work has also focused on gene profiling and why post-viral fatigue persists in some subsets of ME/CFS patients. So welcome to the show, Dr. Kerr.
Thank you very much for having me.
So after a kind of brief hiatus from publishing, and you also relocated from the UK over to Colombia, you and your group published a new paper just this year in the journal Mitochondrial. You found a prevalence of 2 mitochondrial DNA mutations. Now, this isn't a classical CFS paper, although you mentioned CFS, you also mentioned fibromyalgia and some other things. So you call these functional diseases, and these mutations are in functional diseases. So if you could kind of start and tell us, what did you guys mean when you described functional diseases?
Well, functional is an arbitrary term to include certain symptoms which are common to multiple diseases. And these symptoms would include pain, nausea, fatigue, for example, low energy, poor sleep. And basically, the idea for this study was not mine. It was Richard Bowles, who is from UCLA in Los Angeles, and he has a long history in this area. And previously, he'd found that these mutations in the mitochondrial DNA were found in certain syndromes like migraine, cyclic vomiting syndrome, and non-specific abdominal pain. And he wanted to look further to see whether chronic fatigue syndrome patients also exhibited these mutations. Mm-hmm. We found that they occurred in chronic fatigue syndrome with roughly the same frequency that they occurred in other functional syndromes.
Now, are you confident with these results? I mean, a lot of mutations we see are just common in the overall population. So is this data strong enough to suggest that this is significant? What do you think the significance of this finding is?
Well, I think it's very, very interesting. I think it would need to be repeated. Mm-hmm. And the biggest proviso with the study was that we looked only at haplogroup H mitochondrial haplogroup H patients. So this is roughly 30 to 50% of cases, and there are many more different mitochondrial haplogroups, and the equivalent mutations in those have not been identified. So it is a very complex area, but what we do have is a very interesting result, which fits with other of these diseases. There were 7 diseases looked at in total. Chronic fatigue and 6 others. And it's just a very interesting phenomenon, given the fact that mitochondrial abnormalities are known to play a role in chronic fatigue syndrome. And even with mitochondrial disease, you get abnormalities in the mitochondrial anatomy, which has also been documented in chronic fatigue syndrome. So it's very, very interesting. And your specialty is the diets, mitoprotective diets. I mean, these are also known to be beneficial in chronic fatigue syndrome. And certain supplements, such as coenzyme Q10 and riboflavin, which is vitamin B2, are known to improve symptoms in chronic fatigue syndrome. So the different pieces of the puzzle do fit together quite well.
Right, but it's too soon to maybe say that could this be a potential biomarker one day to define these groups of people that may be susceptible to develop functional diseases?
And possibly one day. The difficulty is the different haplogroups. If this was just a regular somatic SNP, single nucleotide polymorphism mutation, then this would not have the same complexity. But the fact is that there are all these different haplogroups of mitochondrial DNA which complicate the situation enormously.
And one thing that's unique, maybe our listeners aren't aware of, mitochondrial DNA differs from nuclear DNA and that it is much more vulnerable to mutation, right? It lacks protective molecules, and it doesn't have the same DNA repair mechanisms as nuclear DNA. So mitochondrial DNA mutations are quite common, which raises the question then, a lot of patients have viral triggers, right? So what's the connection between these chronic viruses? I know you've studied quite extensively parvovirus B19. How is there a link there with the viral infections in the mitochondria?
Well, the answer is I don't know, but for sure.
Neither do I, right? We have some.
But it's likely that these are, that there are multiple hits involved in generation of a syndrome such as chronic fatigue syndrome. So maybe it's recognized there is a minor genetic component, and also there would be lifestyle and the amount of stress that you're under. And in addition, what infections you have encountered and what state of stress you're under when you encounter them. And I think a very big factor which has become recognized recently is the diet that a person is consuming day to day, because you can make yourself prone to a very inflammatory state by eating the wrong diet, and you can reduce your inflammation and thereby control infections and offset any genetic problems that you may have by eating in the right way.
Yeah, absolutely. I mean, that's certainly my forte.
Absolutely. There are so many problems with the standard, as you say, American diet and the standard global diet.
Yeah, it is global now, isn't it?
Yes, it is. We all eat the same rubbish, basically, and too much sugar, too much carbohydrate, too much genetically modified food, and too much, animals that are fed on the wrong food. It's not their natural food, such as the genetically modified grains used to feed cows and pigs, for example.
Right. And I think the research is still a little sparse here, but all of these things I think have the potential to promote mitochondrial dysfunction through perhaps mutation of some of the mitochondrial DNA. A recent study has shown that CFS patients have elevated lactate both in muscle and also in cerebrospinal fluid, which I think is very suggestive of mitochondrial dysfunction, in that mitochondria are not effectively utilizing carbohydrates, and instead they undergo glycolysis, and the waste product of that is lactate. So this is all the more room for a dietary intervention.
Absolutely, yes, indeed.
And in a recent article that you did on Phoenix Rising, you brought up Weston Price, Dr. Weston Price. So how does that all fit in? Dr. Weston Price, his history, his dietary theories, and mitochondria.
Well, yes, Weston Price was an interesting guy. He was a dentist from Canada who worked near Chicago, and he was horrified at the prevalence of dental caries in his patients. And he hypothesized very intelligently that this was linked with consumption of a modern processed food diet, particularly sugar and bread, because this, and in 1938, and when he did his studies, it was obvious to him then that the diet of the region had changed dramatically in the subsequent 40 or 50 years. And so he tried to find evidence for this, traveled the world to visit different tribes, and found that people who ate an old-fashioned diet, meaning a diet without processed food and without sugar, they had much better dental health than the people who had gone to the cities and were eating bread and sugar, among other things, of course. And he also found very interesting that the old-fashioned diet was associated with a very high resistance to developing tuberculosis. He also found that the old-fashioned diet without processed food in pregnant mothers was associated with much better formation of the hard palate and the teeth and the face. Mothers who ate processed food more often developed cleft lip and palate than did mothers eating an old-fashioned diet. And he did lots of studies in this way, and there were lots of documenting pictures of the people on the old-fashioned diet and the tradition and the modern processed food diet. So it's really quite a compelling work, which really provides a lot of evidence that the processed food is a bad thing for health in multiple ways. And it actually makes very good sense. And it makes you wonder why, dentists and dental education doesn't say don't eat sugar, because in my opinion, it should.
Yeah. And I think, again, that hones right in on the mitochondria, right? The mitochondria have to handle all of this food source that we put in. And when we constantly throw carbohydrate at it, we create oxidative stress. We completely stress the mitochondria and have the potential then to set off these mitochondrial DNA mutations or these predispositions that patients might have.
Absolutely. And in addition to that, sugar itself is a toxin.
Right.
Especially in its refined form, it's basically an inflammatory molecule which creates an inflammatory state in the body. And most people who eat sugar, they eat it every day. And so this inflammatory state continues for as long as they continue eating the sugar.
Right. It creates a vicious cycle of chronic inflammation systemically and cellular inflammation, which damages all these key mitochondria.
Absolutely. And it's very interesting that recently there's several very high-profile studies which re-examined the proposed role or presumptive role of saturated fat in coronary artery disease. Mm-hmm. And these studies found no relation between consumption of saturated fat and atherosclerosis whatsoever. Yeah. And now it's more and more thought that sugar may be the culprit.
Yeah, I absolutely believe that. And we actually now have governing bodies making changes there, at least here in the U.S. The USDA is finally slowly coming to their senses in regards to the fear of fat. And I look forward to these changes going globally because, again, going back to the mitochondria definitely prefer to burn fat as fuel. It's much less demanding of cofactors and vitamins and nutrients. And it's just less oxidative stress when you have a higher fat diet and less carbohydrate, less sugar.
Yes, indeed. Absolutely.
So getting back to your recent paper, the subtitle of this paper is really quite comical. So your paper's subtitled, "Are we describing different parts of an energy-depleted elephant?" So how did your group kind of try to address that question? What is the energy-depleted elephant?
Well, this was the idea of Richard Bowles, who works at UCLA. Mm-hmm. And we have a nice picture there of an elephant. Basically, it's supposed to be a metaphor, basically a very large animal with different diseases affecting different parts of the body and being attended to by different doctors who don't talk to each other.
And we see that a lot in CFS, right? It's a multi-system illness. We have gastrointestinal problems, so you go see a gastroenterologist. You have neurological problems, so you go see a neurologist. You go see a rheumatologist. You go see an immune disorder. But as a clinician, are we creating a major problem? Are we not seeing the whole picture of the patient?
Well, I think that the structure of modern medicine, as you just described it, if we have one problem, we go to one doctor, a different problem, to a different doctor, is useful in one respect, and it is basically the most useful in terms of surgery. But in terms of understanding pathogenesis and solving complex problems like chronic fatigue syndrome, it's quite unhelpful because I know in my own experience in medical school, we would go to rheumatology classes to learn about rheumatological diseases. And then we would learn that 30% of patients with rheumatoid arthritis also have atherosclerosis. And that seems like an interesting part of rheumatoid arthritis. It was very little known in the day I was in medical school. So basically these exceptions always have to be remembered. But basically every disease, every medical disease is a whole body event. Mm-hmm. And what's very interesting, I think, about these chronic diseases is the prodromes of them. And because basically patients who develop rheumatoid arthritis or some other rheumatic diseases, frequently have a prodrome lasting years in which they have a virus infection and it smolders on and they feel feverish and they have chills and it lasts for many months. And only after a long period of time do they develop joint pain. And that's the time in which they go and see a rheumatologist. And he begins the process of giving them different anti-rheumatism drugs. But basically the pathogenesis of the disease is not understood because that prodrome is not understood. And that is what triggers the whole thing. So I think modern medicine is very helpful in some ways, but quite unhelpful in others. And this is what this energy-dependent elephant is supposed to illustrate.
Right. And I practice under a functional medicine model, which I don't know if is a popular term in the UK or in Colombia, but that's
it's a rarely used term, but in this case, I think very helpful.
Right. You have to look at the whole picture of the patient and appreciate disease as systemic. And then look for underlying root causes. And the more I'm learning and the more I'm working with patients, I keep coming back to mitochondrial dysfunction. And we were talking earlier about mitochondrial dysfunction and the link between that and autoimmunity. I think we're going to see more and more of this coming out. And clinicians are going to be forced to kind of think a little bit differently in order to treat these kinds of patients in these difficult cases.
Absolutely. I think one of the biggest areas that modern medicine has to improve upon is the whole issue of diet. I mean, it's been said, I can't remember by whom, but that let medicine be thy food and food thy medicine. And I think that's a wonderful quote. And it is true because it's possible to make ourselves sick with the wrong diet.
Now, I know a lot of patients and a lot of listeners of the show do try to eat this unprocessed natural diet, and they have different approaches to it. What do you think is going on for the patients who do everything right as far as it goes? You know, they have a perfect diet and they still don't make any budge in their energy meters, and they no improvement whatsoever despite this Western price type diet.
Well, there are so many factors in the pathogenesis of any chronic disease, and that includes chronic fatigue syndrome. So I think there would be psychological stress. And I mean, everybody suffers from that. I do myself. Mm-hmm. And I have to rationalize to myself to calm down about certain things and let certain things go because they're not that important, et cetera, et cetera. So that's something we all struggle with. And then there's our genetics. Our personal relationships, are they supportive? Are they not? There's just so many factors. Would include diet, our lifestyle. Do we drink a lot of coffee? This is something very prevalent in today's society, but it's not a helpful thing. It's not helpful in terms of health. So it's a multifactorial illness, and I think there are many avenues to explore. Even if a person is taking a perfect diet and they still lack energy.
Now, in your paper, you mentioned two kind of defining characteristics of all of these functional diseases. And that one is mitochondrial dysfunction, which we've discussed already. The other one is autonomic dysfunction. So what is the connection there? Or is it a chicken or the egg kind of thing?
Well, basically, the mutations that we found are in, the 16519 polymorphism is in a control region involved in mitochondrial DNA replication, and the 3010 is in the 16S ribosomal RNA gene. So the mechanism of their influence on health is not entirely clear, but it suggested that there could be some abnormality in bowel function. And, we know chronic fatigue syndrome has different autonomic abnormalities, and that fits quite well with mitochondrial dysfunction, because these mitochondrial disease tends to involve a lack of energy and an autonomic dysfunction. So we have both of these in chronic fatigue syndrome. The problem is that it's multifactorial, and it's difficult to know what comes first. But So it could be that you have a poor diet and a state of inflammation which favors mitochondrial polymorphisms, mutations, or it could be that we've inherited those polymorphisms which then make us more likely to handle the modern diet in a way that results in disease.
You've been in this field for a long time now, and there's a lot of new research coming out within the past 5 years or so. Is there anything that's really stuck out with you in the ME/CFS research field that you'd like to see more investigation, something that's really caught your eye as of late?
Well, I think I would like to see less rubbish psychiatry, and I think that's become more and more prevalent. The theories that they have for why people do not respond to the exercise treatments, I think, are quite ridiculous, and I would like to see less of that. I would also like to see more research in the mitochondrial area. I think that's the evidence for a mitochondrial abnormality extends back for a very long time, and there are multiple pieces of the jigsaw which have become slowly apparent over the years, and it does fit with the clinical presentation of the disease. And I think that it's very likely this plays an important role in the pathogenesis of chronic fatigue syndrome.
Yes, that's something I would love to see as well. But as we all know, research funding for this illness is hard to come by, right?
Yes, it is.
So is there anything that you're working on now that you could speak about?
Well, we have a project going in Colombia. The situation in Colombia is quite different to that in the developed world. Here, there are a lot of unfortunate people that have to do very bad jobs, dangerous jobs where they're exposed to different toxins or problems or dust or whatever, and they have very poor health. But as a result of that, one of the studies we have at the minute is studying agricultural workers in the country and their exposure to pesticides. And from previous studies from the university here, it has been shown that exposure to pesticides can trigger a chronic fatigue syndrome-like disease. And obviously this is known already. Studies from England, studies from other parts of the world have shown the same thing. So we have a study going on agricultural workers in different parts of Colombia at the moment, but no results as yet.
Interesting. Is that looking particularly at glyphosate?
Well, there are different cocktails that are used, but basically growth of rice and potatoes needs a lot of pesticides, and needless to say, these are genetically modified rice and potatoes, basically foods with negligible nutritional value. They need the most pesticides to grow, so the different cocktails are used in each. It's very interesting. It's a scandal, really, that the people are exposed to these pesticides in this way without proper protective equipment, because that's the way it is here.
Is there any interest in ME/CFS research in South America? Is there any research groups working in that area?
Well, not directly, but there are clinics where chronic fatigue syndrome patients are seen, and fibromyalgia patients, and others, from pain clinics and neurological clinics. So it is possible to study chronic fatigue syndrome here, although it's definitely not as easy as it was in the United Kingdom.
Mm-hmm. And that's one thing I would say in general about the research. I think it's a little biased, and it's mainly looking at Caucasian population and female population, and it doesn't take into account minorities and how we might have different subsets in different types of people.
Well, absolutely. That's a very good point. And as we know, it's a heterogeneous disease. So one person with chronic fatigue syndrome will have a different spectrum of factors active in the pathogenesis of their disease than will another person. And because they're triggered by different viruses, they have different lifestyles, they have different diets, they have different genes. So I think that's a very good point.
Mm-hmm. And that's something that you've also done some work on, is the gene profiling, try to figure out these different subsets Any more insights on that with new information or ways that maybe we can identify these groups?
I think part of the problem is that chronic fatigue syndrome has been lumped together into what they've tried to make a single disease. It's got a lot of heterogeneity. It's not a single disease. And I think this is one of the reasons why we have difficulty studying it, because propaganda tells us it's a single disease.
Mm-hmm.
And to some extent that's necessary because we need to all get together as researchers and doctors to study the disease. But we should also remember that it is heterogeneous and that, for example, there's the group triggered by one set of factors or one infection, and then a group triggered by a different infection, and then another group which is more of a pesticide triggered group,
mm-hmm.
and another where factors can't be identified. And we do know that antibiotics and antiviral drugs can help, but it's all about selecting the patients for the use of the individual drugs.
Right. Antivirals don't work for everybody. It's
exactly.
Bag. There's obviously, this is further complicated with the diagnostic criteria and the constant battle between how do we diagnose this illness. So, but it makes for messy research and even more complicated patient care, I think.
Yes, it does. It has muddied the waters quite considerably, but...
Right. So instead of, for many, many years, we're trying to find the virus, hunters looking for this virus that triggers the illness, I think maybe instead... and you guys talk about this in your paper, we need to start to instead classify these as not infectious diseases, but mitosomatic diseases. And I love how you coined that in this new paper. So what are we talking about when we talk about mitosomatic instead of maybe infectious or even psychosomatic, which is a terrible word associated with ME/CFS?
Yes, it is. Well, mitosomatic will be abnormalities in the mitochondria, which result in partial disability of their function, resulting in somatic symptoms. And I think it's this paper looks at the mitochondrial angle, but within an individual there are multiple factors in the pathogenesis, and I think they all interact. It's my belief. And you mentioned we're always looking for the virus that causes this disease or that disease. It's very likely, and it's my belief, that these chronic autoimmune diseases, which includes CFS, because there are autoimmune features of it, are caused by multiple viruses. And it's not realistic to expect to find a single virus or a single pathogenic factor that accounts for most, because they're all multifactorial. There are multiple viruses, and it's rather difficult to talk to people about it sometimes, because it's always assumed that there will be a single virus discovered at some time in the future, which will then explain all the causes of one particular disease or another.
Right. That's naive thinking. I think I don't like to say it that way, but a lot of patients, would really love to have that answer, one easy answer, and one solution. And so far, we haven't seen that, and I don't think we will, because these illnesses are so complex. They're so multifactorial. The solution, the cause is more than one. The solution is also going to be more than one factor.
Yes, indeed. And then the patients have had a hard time, and it's understandable that they would wish for a breakthrough that would validate their suffering and their disease and make it a legitimate one, which is something that the CFS patients have to struggle with. But nonetheless, I think there are great breakthroughs to be had in accepting the situation as it is and working with it as best we can, because there are lots of supplements we can take, and there are dietary modifications for mitochondrial aspects. For the virus aspects, if we can identify which virus triggered our chronic fatigue syndrome, which is difficult, but if we can do it, we can use a specific treatment. Mm-hmm. And if we are conscious of ourselves and aware of certain things that make us stressed, we can manage that better. So I think there's multiple ways in which CFS patients could effectively manage their illnesses, and it would be a proper management. I mean, basically, there is this illusion that the management of other diseases such as rheumatoid arthritis and multiple sclerosis is much better than the management of chronic fatigue syndrome. Mm-hmm. Well, it is and it isn't. In one way, these other diseases have a better image. But in another way, we don't have cures. Right. So it's just juggling of drugs, really, for a lot of these diseases. And they could be managed better in terms of diet, virus infection as well. So I think in some ways, CFS patients are in the same place as these other diseases.
Great. That's a really hopeful message, actually, to end our interview here. We're about out of time. So I think there are definitely some solutions, the more pieces of the puzzle that we put together. So thank you so much, Dr. Kerr, for taking time to do this interview today. And I look forward to seeing some more work published in the coming months and years.
My pleasure. Thank you very much for having me, Dr. Craig.
Okay, that wraps up another episode of Spoonie Radio. If you like the show, be sure to go over onto iTunes. I would appreciate it if you would rate and review the show. Don't forget to subscribe so you never miss an episode. This is Spoonie Radio signing off.